All right. Good afternoon or morning, everyone, depending on what time zone you're in. My name is Rosemarie, and with me is my colleague, Sarah Matousek, and we are delighted to be hosting the first of what we expect to be a series of weekly check-ins and to provide you with some insights that we have as experts, both professionally and personally in leading and managing through crises. We decided that the magnitude of the coronavirus episode that we are living through is so vast that it was important for us to reach out to people in our community and provide the best information that we can to help you lead through this, both personally and professionally. And Sarah and I decided to break out of our usual webinar format where we throw a bunch of slides at people and expect you to be taking copious notes, because it just seems like folks are pretty overwhelmed right now, and that what you need is some context. You need to see us face to face and be able to interact with us. So we decided to create a series of Zoom sessions, and this is the first one. So we are probably still working out some kinks. So bear with us if we have any technical difficulties, but we do want this to be interactive. So if you are proficient with Zoom and can use the chat feature, then please, type in your comments or questions. We really want those, and we want your feedback at the end. And we will be addressing as many as we can in this 30 minutes. So first of all, I just wanted you to know why we're doing these sessions. Next, I want Sarah and myself to just tell you a little bit about our background and why we understand crises. And then I'll just give you the overview of how we're going to proceed. So in terms of my background, I am seasoned enough that I was actually a leader of a large state agency during the 9/11 crisis, and had to basically plan and execute all of our operations during that time. That was at the state Medicaid agency. I then was also leading an organization during the Great Recession, and have continued to manage many crises on the personal and home front over the years. So have lived through many things, lived to tell the tale, and ready to share things with you. Sarah.
Yep. Hi, everyone. So glad to be here. On my end, I've spent the last 15 years on and off working in the country of Haiti, which is a third world environment. And we've had to deal with what I was calling highs and lows and different types of crises. There was the earthquake, there have been hurricanes, but then day-to-day crises are significant there and never ending, it seems. So we've dealt with a lot in that space. And then on the home front as well, I was joking that going through, academic and hospital training has led to the need to pivot very quickly and rapidly. So they're not without small crisis. So.
Thank you, Sarah. And Sarah is on the western side of the U.S. She's actually in Spokane, and I'm here in Somerville, Massachusetts. So we are spanning the country, as it were. So what we're going to do is give you some context for crisis, both at the mega kind of landscape level, if you will, and then at the personal level. So we're going to give you just two graphs. That'll be the next session. Then we're going to give you what we would recommend to be the crisis response, and we're going to call that the 3 C's, and that will help you both at the personal and professional level. We'll open it up to Q&A, and then we'll close with a moment of inspiration, reminiscent of when the Daily Show would do the moment of Zen. We were kind of inspired by that. Meanwhile, I do have, just as one metaphor to keep in mind, my keep calm and carry on mug that I'll be drinking some water from during the session. When this was given to me years ago, I thought, isn't that nice? It's such a historic relic, how people got through World War II. But I have to say, I just pulled it off my shelf and said, this is going to be my main mug for a little while. All right. So with that, let's turn it to the next slide. And again, we promised you only 2 slides, so you don't have to take tons of notes and try to remember too many things. Again, knowing that folks feel very overwhelmed. So the crisis that we're in with coronavirus is really something that experts who study crises would call a landscape scale event. Um, Probably doesn't totally need explaining because you are living it right now. But landscape scale is different from crises you may have experienced before in organizations where something went wrong in your organization and you have a PR disaster or a major fail of something in manufacturing or something that lost the trust of some of your customer base. These are kind of things that when you're in business school you learn crisis, and we have a crisis communication plan. You develop the response, etc. Landscape scale means more like the whole society is affected. And what makes this, I think, particularly unique is that not only is every organization affected, everybody's being affected at the personal level with these stay-at-home requirements. And so it is rippling through basically every aspect of your life. And that's really different, I think, from many of the things we've been through before. But all that being said, there are still 6 definable stages of a crisis. The first stage is the warning signals. We are past that stage. And the next stage is risk assessment. There are a lot of people still working on risk assessment, but I would say we're actually in the 3rd stage right now, which is the first red zone, and that's the response stage. It is not a perfect response. It is, as with most things human, somewhat muddled, but we are definitely in response and hopefully moving to the next stage, which is management. And that's going to vary depending on where you live and the public leadership that you have. But it's really heartening to see how many people are stepping up to truly embrace the science and the facts as best we know them so that we can get out of management to the 5th stage, which would be resolution of this crisis, and ultimately where we want to be, which is recovery. So those are the 6 stages. I think it's just helpful for context setting to kind of know we're in it. We are in this red zone, and as many experts are saying, it's going to get worse before it gets better. And worse means a lot of different things, but one big one is that we are going to see more deaths before we really get a handle on how to test and take care of the people that will need the care. So that's what we need to expect and brace ourselves for. So that context, I hope, will be helpful to you. And then I want to hand it over to Sarah, who has a graph that will help you understand what could be going on for you at the personal level.
Yep. All right. So before we lose people, don't get too worried about this grief cycle. I think pretty much everyone should have heard of the grief cycle or the 5 stages of grief, but it's a very useful framework in which to place your current feelings or emotions or context. In fact, I didn't find it until this morning after we had decided to do this, but there was a Harvard Business Review article that came out Monday that talked about this very thing, that said folks were sitting in a meeting and were saying, you know what I'm feeling is uncomfortable. And someone said, that's grief. And I think we're all feeling grief in some way or another. And so these stages can just be helpful. If you name it, you can manage it. And so the first is denial. I'm just going to walk through very quickly. This is really meant to minimize acute pain. And so it helps folks ease into feelings of discomfort. And so denial has its purpose and its place. And I think we've seen a lot of that over the last few weeks. And then moving into anger. And again, these are not a linear flow. Folks can come in at any point, and it doesn't have to follow in this order either. Anger is the second. It's very common, obviously. It's the emotion that kind of comes upon us when we are adjusting to a new reality, which we're all doing right now. And it's often the response when your extreme emotional discomfort becomes apparent in your life. And then moving into bargaining, this is, you've probably would think of, it's when, you know, you're about to lose a loved one, or you have, and you are bargaining with some higher power to, you know, make it better or fix this situation. In our case, you know, we take it down a notch, and perhaps it's all right, if I social distance for 2 weeks, this is going to go away. That's the kind of bargaining that we're talking about here. Then there's depression, and this is where we'd like to sit for a minute, you know, because we in our society are not used to feeling uncomfortable, and this level of discomfort, especially at scale. And so there's overwhelm, there's feelings of a lack of control. We don't know how long this is going to happen. One of the phrases that I read about used, anticipatory grief is in this depression phase. Like we don't know what's going to happen, and so we're just grieving in anticipation. It's very unusual and uncommon feeling. But the sitting with the depression feelings and the discomfort is very important, because if you're used to avoiding those types of feelings and going and doing something to, you know, like shopping that you can't do right now or other things, it can be really challenging. The fifth and final is acceptance, and we are I am experiencing right now. Somebody interrupting me. Don't worry, the door is locked. The fifth is acceptance, and this is just exploring options, and putting a new plan in place to move on. And there's actually a sixth phase that David Kessler wrote a book about, which is finding meaning, and I think that we'd like to talk about that in future sessions. But acceptance is this wonderful, okay, you know, we know where we're at. We actually don't anticipate the world going back completely to normal, and we'll talk about that in a second. So accepting what that new normal is and then finding meaning in it is going to be really important for all of us. But there's some hope there, so I think that's a positive message.
So what we wanted to do next was juxtapose these two frameworks, so that you can see that as we're going through this landscape scale event, and you're also living your life personally, that they actually kind of mesh. And while we can't put an exact timeline on this, I think that understanding that, you know, we are here, we're in the red response and hopefully moving into management phase, is also going to coincide with many, many people personally in this kind of anger, bargaining, and depression stage, which, as Sarah said, you can move in and out. One day you may feel like, okay, I'm not angry. I'm just going to like bargain it. Let me do my 2 weeks of social distancing and I'm good. I'm going to set my sights on that. And then you'll get some new input, like it might be longer than 2 weeks, and then you're angry again, like whoa, and then maybe you get depressed too. I mean, so it's fluid, but in this red zone, we expect to be more in this kind of trough of the blue zone, and it's helpful, as Sarah said, to understand that and know that that's normal, and that, you know, regular activities are much harder to do, not just because of logistics, but also because of what you're facing personally. I likened it to headwinds, just getting up every day and moving forward with your usual to-do list, which of course isn't even the usual list, but if it were, it's just harder to do those things. So it's just, you need to understand that and accept that on some level. But where we want to get to as a society is the resolution and into the recovery stage. And at the personal level, there will be hopefully some level of acceptance of what we're calling that new normal. We don't exactly know what the new normal will be ultimately. It is not going to be that we are all staying locked in our houses forever. That is completely not viable. Any expert would say that. They can't tell you exactly when we'll get out of this stage, but whenever we do, it's not going to happen on just one day, like we ring a bell and everything's all good again. It's going to be a phasing out, and some people again have used the term muddled. It's going to be imperfect, but we as a people are going to do the best we can. And so on some level, that's us individually getting to some acceptance, and that helps with moving from resolution into recovery. And the example we've been talking about here at Day Health is really what we lived through as a society in the US after 9/11. And it was a very fearful time for those who remember. We didn't know after the Twin Towers fell what else was going to happen. We were monitoring other important national monuments, doing things because we had no idea which other shoe was going to drop, how many, and how at risk we were. Looking back, we know that, okay, we managed through that. We were able to start reducing the risks, begin to understand and know the unknowns, as opposed to having everything be unknown. And we also started to adjust as a society. How do we take precautions? Now it is completely normal that when you go to the airport, you go through TSA, and there's no one who's really challenging that at this point. It is the new normal that we as a society adapted and adjusted to. Of course, some of us complain when we're in line, et cetera, but the thing is, we did make a significant adjustment. We were able to do that. And now my own children don't even know what it was like prior they don't even know the days it was like that you could go to the gate without going through a major security check, because it's all just changed. And so there will probably be some level of change after this coronavirus because of the landscape scale of this. We don't know exactly what it's going to be, but I think we just have to anticipate that we may, as we move back into recovery, it'll be different than what we knew prior to coronavirus. So in terms of responding to all of this, I want to move to, and I'm going to be really low tech here, because I like it when some people have done this for me on the on the Zoom calls I'm phoning into. We have 3 C's, and these are what we want you to take as takeaways from today: compassion, connection, and control. And those are what we're recommending our response to this landscape scale event and managing through the grief cycle. Because you've got to be able to lead both personally, confident, and professionally. And we think that what these 3 C's you do to focus on will help you in all the arenas in which you have to operate. Many have become blurred. The lines are blurred now between personal and professional. So I'll start with compassion. And what we mean by compassion is both compassion for yourself and compassion for others. So we'll have lots of ideas of things that fit into these 3 C's, and we want to breeze through a couple of them right now and then be able to open this up for questions. But examples of compassion for yourself right now would be to understand that you probably are somewhere in this grief cycle, and that what you need to be able to do is give yourself some breathing room. Do the things that give you some space. Even if it can't be physical space, that meditating thing is something I am actually going to begin actively practicing. I'm saying it here now because I've always intended to and never quite gotten there. So meditation is one. You are allowed outside, so exercise in any form, fresh air, great things. And don't deprioritize that. Give yourself some breathing room, clear your mind so that you can be available to people. Those are just a couple quick things. But self-care where you can, and maybe in some ways you've never really got around to doing, this would be the time. Sarah's going to take compassion for others.
Yeah, so just briefly, one of the items that has come up over and over is thinking about how to be compassionate to others. I do have some friends that are going around and dropping off items for homes where folks can't get out, puzzles, games, that sort of thing. So that's a do activity. But really, the compassion for others that our family is showing is just staying home and not going to visit people that we love, like our grandparents or my in-laws. So that is practicing compassion, because we're aiding in dampening this curve, as we keep hearing and saying. So pretty simple.
And adjusting, because those of us with elders who we can't visit anymore, we are helping them download Zoom or doing FaceTime, or things we may not have had to do in the past, and now we are doing it so that we can stay connected. And that's a segue to the next one of the 3, which is connection. So it is really important we are social creatures. So in this time where we're being told we've got to have social distancing, that is actually going to, for many of us, create a path to depression. So in order to avoid that, what we have to do is practice socializing distantly. So that means we have to find new ways, like I just said about Zoom, that people may have never done before. And I just did it with a bunch of my female friends who had not had the benefit of being in work settings that did these kind of conference calls with Zoom. And so we did it, and we all felt like, oh my God, it's like when we were sitting around a kitchen table together. And it was so comforting to be able to do that. We shared a glass of wine or beverage of choice. I hear quarantinis are great. And that was a way that we were able to stay connected and feel, pretty close to normal in terms of the camaraderie. So figuring out how to do this distant socializing in our evolving new normal is super important. Stay connected. And that's true for your work world and for your personal life. And then the last one of the three is control. And we don't mean like command and control. That is not a leadership style we would recommend right now. What we really mean is like how to try and make sense of this landscape scale event and feel some sense of control in your world when probably many, many things feel out of control. So I'll hand that one to Sarah.
Yeah, so we've been talking about this quite a bit all week. The concept of having a growth mindset. I know many folks have read a book about having a growth mindset versus a fixed mindset. But basically that means, and I'm being low tech as well, is that you have a box, and inside that box is a circle. And in the circle are things that you can control. And inside the box and not in the circle are things you can't. And so just being honest with yourself and even going through that, it's a silly little exercise, but it's very, very powerful. Focusing just on the things that you can control and then naming the things you can't so that you can then push them aside. And that works with teams. There are a lot of leaders that are actively trying to get their teams and their organizations on board with what's happening. And I think focusing on what you can control in your business is great. Focusing on what you can control in your life is great. So, for us, one of the things I can control is the fact that I have lots more time right now, that I'm not driving to a number of different places all week long, or, going shopping or doing other things that I didn't even realize took a lot of time. And so, planting a garden is something we're doing, and fixing broken things around the house. That's personal, and that's sort of helping. I can also control our response. As I mentioned before, we're staying home and we're not seeing people that we love. And I can control that, can control our reaction right now. I can't control the way that other folks are responding. I can't control the federal government or even our governor. I can't control the way that other people are responding, but I can do what I can. So just knowing that is actually taking the stress down a lot. And so in business and personal life, controlling what you can and doing your best to toss the rest out the window for right now has really been helpful.
Thanks, Sarah. So at this point, we wanted to open it up to some questions, and I know we won't have lots of time for that, given that we wanted to keep this to 30 minutes to let you go on. So we will just open up to questions, and I think that Maria is helping us field some of those. So do you have anything, Maria?
Hi, so I'm waiting for some questions to come in. We can start with a question for Sarah. Sarah, you've had some experience with crises in Haiti. What lessons can we take from third world experience to draw from for crisis management in the United States?
Yeah, so I would point folks to anything written by Paul Farmer or that comes out of the Partners in Health office. He's written a number of books, one of them specifically on the earthquake in Haiti and then the hurricane subsequent to that. I believe it was Matthew, and how they handled that crisis response in a low resource setting, which it's, in parts of our country right now, we're looking at low resource setting, to be honest. It's crazy to say in this country, but I've got, my husband wasn't able to operate today because they don't have enough HEPA filters in their OR, which is ludicrous, but they're using them all in anesthesia. because of this crisis. So I think taking from what folks have done in low resource settings is helpful. That said, let me just give a more general concept for folks to take home, which is that, we're very used to in the US controlling our environment. We have thermostats almost in every room. If we're hot, we can get cooler. If we're cold, we can get hotter. We can make that work. But in other countries, you can't do that. And so in my experience, I've learned to sit with discomfort in those places and, sort of accept it. And so I think one of the things that we are now doing actively as a country is being uncomfortable and sitting with that. And it's going to, create ingenuity and innovation and the ability to sort of rise up together. And we're also building a resilience and a grit that I think maybe we've been lacking in some ways. So those are the things that I've learned that I've pulled over. And there are books about other things. I could go on and on, but I'll leave it at that.
Thank you.
Okay, we have another question. Given the frameworks you provided, how should we talk to people who are reluctant to practice proper social distancing? Do they need to move away from the denial phase?
Yes. Yes, for the good of all of us. I mean, honestly, this is such an illustration of how interconnected we are as human beings, and how important our health is. It's not an individualistic thing. It is a collective thing. And so I hope that's going to be one of the things that is a big takeaway from going through this. We need to be gentle with people and recognize that they are probably going through, that this denial is a human reaction to pain. And so, coming hard on people who are probably experiencing pain, and particularly when you think of folks who have hourly wage jobs, et cetera, and are facing economic hardship like right now. They're not in the position where they can work from home and do things like many people in our professional world have been able to kind of pivot and start to adjust to. They are just facing complete and direct economic pain in their families. And so you can understand why there would be some denial, for many folks. And so being gentle, but we need our public figures to be role modeling, and we ourselves need to do that. Sharing the message through social media and showing people how to do this is what's really, really important to do right now. So we have time for maybe one or two more questions, and what we would love before we wrap up is just to get your feedback. If there's anything we said that particularly resonated or was helpful, we'd like to know that. Are there things you'd like to know more about? Because we'll be back next Wednesday at noon Eastern time with another session, and so we want to make this really useful for you. All right, is there another question, Maria?
Yeah, I think this is a good question to end on. So one potential challenge is knowing which sources to trust and potential scams. Do you have any words of advice for us, especially with grapevine gossip in business settings that quickly spread misinformation?
Well, I just saw this morning, I read a mainstream news source, New York Times, and they're saying that there's been an uptick in how many people are turning back to mainstream television channels to get news, and to not have as much of the cable broadcasting, but just kind of taking it down the middle and bringing science and facts right to the fore. So interesting. Mainstream media has been maligned over the past several years, but there's a tremendous value, particularly when we've got a collective problem as big as this one. So I'm going to give a shout out to mainstream media. I also, am active on Twitter, and there's some folks who I just love to follow who, give the straight, raw information, in the moment as they're finding it out before it even makes it necessarily to a mainstream story. Two people that, actually I'll say three that we're following, Andy Slavitt, former administrator of CMS for President Obama, Juliet Kayyem, who is a faculty member at the Harvard Kennedy School. She's on CNN, and she was a former Assistant Secretary of Homeland Security, and Dr. Atul Gawande, who probably most of you have heard of. So those are three people who are actively tweeting and really worth listening to. They only deal in facts, and they're very candid and sometimes even funny. So great folks to follow. So I think we'll end there, and what we wanted to just leave you with is this: one of our heroes. We have many, but Nelson Mandela is certainly one who comes to mind right now. A quote that kept me inspired during some hard times: "It always seems impossible until it's done." And for someone who was imprisoned for years and years and found a way to manage his mindset and in extreme hardship, make the most of that situation and come out as a strong leader for his people, I think is remarkable. And we just want to end on that note of inspiration. So thank you everyone for tuning in. Hang in there and please stay home.
For now.
Thanks. Bye.